Okay, thank you very much for coming on board. And we are very glad that many of us we have joined right on time. Once again, thank you to this, welcome to this program, World Toilet Day, with the theme that we are on today, End Open Defecation in Lagos State by 2025. My name is Biodun Doati. I'm one of the co-hosts for today. I'm a co-host for today. And with me also is Mr. Adebayo Okuwabi, who is also going to be co-hosting this program with me today. I think it would be nice to have you say hi to all our participants and speakers that are here already. Mr. Okuwabi, you can unmute yourself and say hi to all our participants and speakers that are here already.
Thank you very much, Mr. Biodun Doati. Good morning, distinguished participants. You are highly appreciated for making our time this morning to attend this memorable occasion. Well, we look forward to having a very good program, going by the number of people that will be presenting and will be partaking in the discussion. You're welcome. Good morning.
Okay, sir. Thank you very much, sir. Okay, so I will give us just a quick overview of the program for today, and then we will start straight away. We have our keynote speaker will be the permanent secretary, one of the permanent secretaries in Lagos State, Mrs. Aderonke Odeneye. And we have very, very reputable speakers. My co-host will be giving us the bio of each of our speakers before their sessions. So I can see already that we have Mr. Bioye Ogunjobi already in the house. You are welcome, sir. Mrs. Chizoba Chinweze, you are welcome. Dr. Lamide Okulaja, you are welcome. And Mr. Bilal Syed, you are welcome. We are going to start this program with a session by each of the speakers giving us some view inputs on different aspects of the topic of today. And we know that while the program is going on, you may have one question or the other that you would like to throw to any of the speakers. So we encourage each one of us that are going to be having one question to please use the chat box because we don't have the time to take individual questions because of our time. So we encourage you to please send in your question through the chat box, and they will be curated, and then we will direct it to the appropriate speakers. The convener of this program is Mr. Adeolu Okulaja, and in due course, we introduce him properly as well as the program goes on. My name is Abiodun Doati. I'm a lawyer by profession, a lead fellow, cohort 16. I'm based in Australia, and I'm glad that this is something that we're all passionate about. We have many passionate and very experienced participants and speakers who are here who share a vision to see open defecation come to an end in Lagos State by 2025. And I'm sure that as we bounce ideas together and we rub minds together and have discussions on this topic, it's going to be an opportunity to generate ideas that can be implemented and that will help us to achieve these common goals that we all have today. So once again, I welcome each and every one of us. And for our speakers, at any point in time, if you need, at any point in time, you can reach out to any of us for any form of support you may need in your presentation as we go along. Mr. Okuobi will give a bio of each of our speakers before their talk, and that will give us an idea of their pedigree and their depth of knowledge in the various sphere that they're going to be addressing during this particular program. Once again, thank you and welcome. Mr. Okuobi.
Thank you very much, Mr. Adwati. Thank you very much, Mr. Duarte. The first person that I will be bringing on to address us this morning is the keynote speaker. It's an honor for me to introduce this morning our keynote speaker. She has had decades of experience in both the public service of the federal government of Nigeria and Lagos State, the Center of Excellence. She is a versatile environmentalist with over 23 years experience with the federal government in the federal corridor at the Federal Ministry of Works and Federal Ministry of Environment. She worked at the Federal Environmental Protection Agency and transferred the service to the Lagos State in year 2010, traversing the Lagos State Environmental Protection Agency, Lagos State Safety Commission, and the Environmental Services Department of Ministry of Environment. Can we welcome to the podium this morning the Permanent Secretary, Lagos State Ministry of Environment and Water Resources, Mrs. Belinda Aderonke Odeneye, as she delivers the keynote address. Thank you very much. Mrs. Odeneye, please unmute yourself.
Hello, Mrs. Odeneye is going to join us very shortly. She's actually having some technology challenges. I think we should just go on to the next speaker, and we will take her keynote after that. Thank you.
Okay, thank you very much. As earlier mentioned by Mr. Duarte, we have lined up this morning some very articulate speakers to share thoughts with us on open defecation and other things that they would like to, other views that they would like to share. I'm going to bring them up in no particular order, but each of them will be allowed to address us for 10 minutes. Now, the first person coming up is Mr. Bioye Ogunjobi of UNICEF Nigeria. Mr. Bioye Ogunjobi is an experienced person who has represented United Nations Children's Fund for a while. He's a WASH specialist from, and has acted Sorry, I'm having. Mr. Ogunjobi is a WASH specialist. He has been collaborating with many bodies in getting his assignment done. recently, no, I'm having an echo. Mr. Ogunjobi has collaborated with the private sector to tackle poverty and WASH challenges in Nigeria. Can we just have Mr. Ogunjobi on the podium to address us this morning?
Okay, thank you
Mr.
very
Ogunjobi,
much. Thank you very much.
kindly unmute yourself.
Yes, thank you very much. Good morning and good afternoon, everybody. I don't know, Mr. Abiodun, can you give me the opportunity to share my screen, if you don't mind?
It's been done already.
Mr. Abiodun?
It's been done
Thank you.
already.
Thank you very much. So I'm not going to take much of our time. Sorry. Yeah, I can't access it. Okay, but I also know that I share with you. I don't know if you can get that from me. Okay, can we see my screen now? Please, can we see my screen?
Yes, we can.
Yes, we can.
Oh, thank you very much. So I will just be quickly talking about, we know why we are here today. We are here to celebrate toilets. I tried to put that in parentheses, and also to raise awareness about the 46 million Nigerians who are still living without access to safe sanitation. In fact, we have 46 million people who are still practicing open defecation. And I also believe that we are trying to establish a critical mass of people who could work together to support the Lagos State government to end open defecation. And I'm also not very happy to say that we have over 5 million Lagosians who still do not have access to basic sanitation services. And unfortunately, 1 million of them are practicing open defecation. So these are the issues I think we want to discuss today and see how we can chart a way forward. Now, very quickly, I've talked about this. In Nigeria, we have 44% of the population who have access to basic sanitation services. And out of this 44%, we have 53% who are living in urban centers.
Sorry, Mr. Ogunjobi, we can't see your PowerPoint. We are only seeing your folder.
Oh,
yes.
You can't see my PowerPoint?
Yes, we are looking at your folder.
Oh, no.
Yes, so you need to open your...
Sorry for that. Let me. I've stopped sharing, and then can you see now?
Yes, we can see it now. Yes. Okay, now.
Oh, I'm so sorry for that. I'm so sorry for that. So I tried to explain that we have 44% of Nigerian population having access to basic sanitation services, and 53% are living in urban and semi-urban settings, and we have 40% living in rural setting. But 23% of this, which amounts to 46 million people, are still practicing open defecation. That is Nigeria. Now, how is this figure distributed? We have a majority of the people who are practicing open defecation belonging to the poorest wealth quintile. And we know why this is so. And then we also have the north central of Nigeria having 51% of this population, followed by the southwest, which is 28% of the population. And then we have the southeast, 21%, northeast, which is 19%, and south-south, 17%. But what we are trying to say here is that the number of people practicing open defecation is widely spread. That's true. 'But we have much more in the north central, 28%, and then we have the southeast, 21%, northeast, 19%, and south-south, 17%. But what we are trying to say here is that the number of people practicing open defecation is widely spread. That's true. 'But we have much more in the north central, 28%, and then we have the southeast, 21%, northeast, 19%, and south-south, 17%. But what we are trying to say here is that the number of people practicing open defecation is widely spread. That's true. region of Nigeria. Now, when it comes to open defecation, as I said, 23%, but when you look at the SDG, SDG is not just talking about safe defecation. SDG is talking about safely managed sanitation. And at the moment in Nigeria, we have only 21% of the population who we could say have access to safely managed sanitation. That's very low, and it's low because the SDG requirements are a bit strict, and it's talking about the use of improved latrines, not share with anybody, and then the excreta are safely emptied, transported, and safely used if need be, in such a way that it doesn't come back to the environment. Now, this is also by state. When we look at the access to basic sanitation state by state, we have Imo having the greatest access, which is 68%. But when you look at the bottom of the ladder, we have Kwara State having only 14%, Oyo having 14%. And then because we are interested in Lagos State today, we can also see that Lagos is not all that good. Lagos has 58%, which means 42% of the population do not have access. Now, when you talk about the open defecation, 7% of the Lagos State population Now, the 7% for open defecation, then you compare to what we have in the Southwest. In the Southwest, 20% of the population practice open defecation, and then 7% from Lagos. Now, what is the number? In Lagos alone, about 1 million people practice open defecation. When you say 7%, you might think, oh, 7% is not too bad. But when you talk about the figure now, it's 1 million people are practicing open defecation. I mean, even one person practicing open defecation is bad enough. How much more we talk about 1 million people. Now, in terms of the number of people who lack access, over 5 million, as I've said. Now, let's look at the different institutions. Now, in terms of the number of schools, we have about 500 schools across the state that do not have sanitation facilities at all. What that means that the children in those schools are going somewhere to defecate anytime they are in school between 8 a.m. and 2 p.m. So definitely they are practicing open defecation. And in terms of primary healthcare centers, over 200 primary healthcare centers do not have sanitation facilities. And then in terms of the public places like markets and motor parks, we were able to single out 40 markets and motor parks where they don't have sanitation facilities at all. So this is the status of open defecation in Lagos State. Now, what has actually happened? I mean, every hope is still not lost. We know that at the federal level, there is a new priority, there's a new focus around ending open defecation in Nigeria. We have a campaign that is ongoing by the Federal Ministry of Water Resources, supported by the government, by the presidency. We also have Partnership for Extended WASH program, which is aimed at achieving the WASH SDGs. And so far, we've managed, as Federal Ministry of Water Resources, supported by UNICEF, they have managed to engage the private sector to find solutions to the menace of OD. Then we've also had declaration of state emergency by the presidency. The roadmap, as I said, exists. Some states have also domesticated the roadmap. We have states like, in fact, yesterday, Kwara did the flag off of the campaign yesterday, and Ogun, I think Ogun is doing today to flag off the campaign to end open defecation. Now, Kaduna is ending their open defecation by 2023. Katsina, Jigawa, and Bauchi, they are planning to end open defecation by 2025. These are all the activities that have actually taken place at the state level. But the momentum at the national level is not all that matched by the state. That's one thing we need to bear in mind. So far, there is an ODF campaign strategy launched by the government, federal government. We have the national slogan, they call is now Clean Nigeria, Use the Toilet campaign, with also a logo, which I put on my front slide. And there's a national steering committee chaired by the vice president to ensure that open defecation ends by 2025. This national steering committee has people from different ministries and also development partners are also serving on this. Now, I am also happy to say that we have state-specific data that each state can use for effective planning and budgeting. It is a 2019 WashNorm survey, water sanitation and hygiene national outcome routine mapping, which UNICEF supported the MBS and Federal Ministry of Water Resources to do. Now, specifically, we have 5 states that have their whole roadmap with costed plan, and they are willing to use this to leverage federal government support and also encourage PPP initiative. And in some states, sanitation financing has been piloted successfully, and we do sincerely hope that this could be domesticated in more states. Now, in Nigeria, out of 774 LGAs, we have 33 LGAs that have now been certified open defecation free across 9 states. Unfortunately, in the Southwest, we only have 1, which is Ifedayo in Osun State. We do hope that Ekiti, because of the effort they have been making in 2 LGAs, we get at least 1 before the end of the year. That's where we are. Now, how does it really play out for Lagos State? I felt that we should talk about what we think Lagos State needs to do very quickly if truly they want to end open defecation by 2025. We think it's important for them, for Lagos State government to come up with an ODF roadmap. What exactly do we want to do? What are the different things that need to be done in Lagos State? We need to also look at engaging the different, engage the private sector, engage the media, very important. They need to engage the media. And we sincerely think that when it comes to engaging the private sector in Lagos State has an edge. There are quite a number of companies in Lagos State that the government can sit down with and agree with them to make a commitment to support the initiative of ending open defecation. And we think that it would be good for us to have a sanitation secretariat, a secretariat that is quite different from the ministry. This is important so that there's not going to be the civil service protocol around the activities of ending open defecation. This happened in India. They did also this in Bangladesh. And I do hope when we begin to look at the experience in Pakistan, this is also going to be singled out. We also believe that there might be a need for the Lagos State government to create a sanitation fund. The sanitation fund will, one, help the people at the lowest wealth quintile who may not be able to buy toilets using their own money. That's one. It will also be a way of leveraging resources, probably from the federal government, like matching grant from the federal government, and also to encourage investment from the private sector. So if the government has their own sanitation fund and they are telling the private sector, we have 10 million, we need additional 5 million, it's much easier that way than not putting any money on grant. And we think we might need to create a sanitation loan fund. As I said earlier on, there are quite a number of people who may not have immediate money, but probably 2 months, 3 months, 6 months down the line, they can pay back if they are giving sanitation loan. But are we expecting the government to do that directly? No. We are expecting government to work with microfinance institutions. The CBN has this kind of fund. It's a program that they do for agriculture. They can also do the same thing for sanitation. And we believe that Lagos State has the leverage to do this. And lastly, we think that Lagos State, we need to sit down with a number of government partners who are working in Lagos and the private sector to coordinate different engagements so that different people will not be doing different things. We shouldn't allow duplications. We should allow coordinated engagement. So we think if all these are done very religiously, we believe strongly that we might get to the end of open education by 2025 as planned. Thank you very much.
Thank you very much, Mr. Bioye Ogunjobi, for your presentation.
Thank you, sir.
The next person that will be addressing us this morning is Mrs. Chizoba
Mrs. Please, can you let me talk? I'm in a place where
Mrs. Odeneye is next, sir.
Please, Mrs. Odeneye.
Miss Odeneye is next.
Ms. Odeneye.
Yes, she's next.
Please, I need to talk. I'm in a program and I'm just taking out time in somebody's car.
Yes, ma'am.
So you're welcome.
I'm sorry for shunting. It's not in my character.
No, you are next,
distinguished participants.
All right. Okay.
Distinguished participants, it's my honor to bring to the podium our keynote speaker, a versatile environmentalist with over 23 years experience within the federal corridor, transferred her service to Lagos State in year 2010, traversing Lagos State Environmental Protection Agency, Lagos State Safety Commission, and the Environmental Services Department of the Ministry of Environment. Can you please welcome to the podium the Permanent Secretary, Lagos State Ministry of Environment, Mrs. Belinda Aderonke Odeneye, as she delivers her keynote address. You're welcome, madam.
Thank you very much. Sorry, I'm happy to be here. Happy World Toilet Day. We're at a celebration outside at Ojota bus stop where there is a public toilet that is being renovated. So I'm bringing you greetings from there. If I stay outside the car, the noise will not let you hear me. So I'm inside the car so that you can hear me. I would have shown you what you're doing. So as I'm congratulating us, I'm also I'll be using the opportunity to answer a few questions that I had. This day we all know is set aside for sanitation and hygiene and to create awareness and also to mobilize resources. As today being World Toilet Day, we're using that to also flag off Lagos State campaign for the use the toilet, clean Nigeria. So we're saying clean Lagos, use the toilet campaign is what we're doing, tying in with what the president did on the November 2019, saying Nigeria being one of the #1 globally in the practice of open defecation and urination. So it has become imperative for us to have a roadmap. In Lagos, we have a roadmap, and some of which I'll just tell you right now. We have out here toilet owners, private toilet owners that we have encouraged and sought out space for them using our Lagos State Physical Planning Ministry to sort out such places. We allow them to build, operate, and make funds and just remit a token to the government yearly. We also have what we call a Lagos Resilience Strategy that has 3 major pillars: an efficient city, an inclusive city, and a prosperous city. That has 10 goals and 31 initiatives, which has to do with treating wastewater from toilets and so on. So we're focusing on even making people to use the toilet well. One of the things we've done is to make sure that all the malls, the petrol stations, public places, they are both government hospital toilets and privately owned toilets that are managed, and then free ones. You even, when I finish, I'll make sure I go around so you can see the people in their regalia. Some of them have toilets that are even temporary that they take care of, and they collect 50 naira, 100 naira for people to use it. But what we really see as a problem is a mindset change that we need to have. People just think that to defecate openly and to urinate openly is, well, something that they can do. We want people to know that it's not decent. Even dogs like doesn't do that openly. So most what we are working now here as we are in Ojota now is to change the mindset of people in terms of where they should open defecate and how they should be decent as human beings. The other thing that I was going to mention too in terms of what we've done, apart from the the toilets that we've provided, the ones we are renovating right now with public-private partnership. We also have what we call Lagos State Anti-Open Defecation Squad. Right now, for those who do it on the lagoon, on the express, we have them. They're all here in their uniforms and all, just to show us what they do. They catch them and they take them to the mobile law court and they do community service, because we found out that people who don't have homes, they don't have anything doing in Lagos, but they are around and they're the ones that just come out and go and open defecate in styrofoam and in nylon bags. So this kind of act, we've been discouraging it with enforcement. So a lot of enforcement is going on, and we know in Lagos we say our cliche is Ajumoshe, and for those who don't speak Yoruba, it means we want to do it together. You cannot use one hand to clap. So we are calling on private sector to make it a business. There's business in waste. There's business in wastewater. You can get all kinds of biogas, manure. You can harvest urine. You know, there's so many things there. So we're calling on researchers. We're working with universities to come up with various ideas on not to waste at all. So, and we are believing that with this theme of sustainable sanitation and climate change that is real, we can make a change. So today we are working with Rekit and Benkiza. We're working with A-Mobile and Bolus, even to make sure that we propagate this sustainable sanitation, and then we do little harm to our climate, to our environment. Once again, I want to thank all of you and let you know that we are in it together, and together we can make a difference. Thank you very much, and God bless you. Have a wonderful day.
Thank you very much, Permanent Secretary, Lagos State Ministry of Environment.
Thank you very much. Sorry that I'm dividing my attention. So sorry.
Are you still? Can I ask a question, madam? Are you likely to be with us for a few more minutes?
Say that again. Say that again.
Are you likely to be with us for a few more minutes?
No, I have to go and welcome the commissioner. He's coming in now and the essay. I need to come out. They are beckoning to me. So maybe okay. I'll read it on the chat.
All right.
I'll read it on the chat.
Thank you very much for that.
So sorry, because actually this program, you should have joined us in this, and then we should have done the Zoom in the afternoon so that everybody is benefiting. But now it's clashing and we are doing the same thing.
Okay. We appreciate the time you spared to be with us, and we wish you all the best in what you are doing for the state government today. Have a wonderful day, ma'am.
Thank you. God bless you. I appreciate all of you. Thank you, the organizers. God bless you. Lagos must be clean. Nigeria must be clean. We say no to open defecation. And by the year 2025, we'll be decent, we'll be hygienic, we'll be sustainable in all our practices. Thank you. God bless you. Bye.
Most kind of you. All right. Distinguished participants, may I have the pleasure to bring our second speaker, Mrs. Chizoba Chinweze. She's a high performance driven researcher with a vast experience in environmental impact and risk assessment and natural resources management. She's deeply involved in research activities on water and land management, environmental change, and human vulnerability. With a background in ecology and varied and extensive training in climate change, international environmental law, disaster risk reduction, and sustainability, can we welcome Mrs. Chinweze to present, to make her presentation. Madam, can you unmute yourself?
Yes, thank you very much for the introduction. Can I share my slide, please? Hello, Mr. Doherty?
Yes, you can. You can.
Yeah, I'm trying to share. It's not host disabled participant.
Mr. Doty, I think you should share to her. I think
no, she has been made a co-host. She can share.
Okay. Okay.
It's saying host disabled participants screen sharing.
Yeah. Can you please try it again?
Okay. 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 Can you see it? Can you see the slide now?
Yes, we can.
Okay. Okay. All right. Okay. So, thank you for the opportunity to share this presentation with us. Our study area is in Lagos State, and then this slide is trying to show us the Lagos State by population. And then we can see that the population we have is concentrated, have more people here in the mainland, showing activities also. Now, looking at taking Lagos at a glance, Lagos is the largest mega city we have in the whole of Africa, with an estimated population of about 14 million inhabitants, and is the largest economy in Nigeria, with 62.63% of the population that live in the metropolis, and we have a population density of about 6,871 residents per square kilometer. The growth rate Lagos expected is approximately 3.3%. So by 2025, we are projected to have about 17 plus million inhabitants in Lagos. However, 66% of this population live in slums, and that is where you have issues of not having good sanitation or people having access to toilets. So we have issues arising at like 1 in 10 children die before the age of 5, in part due to lack of access to clean water and sanitation. So what are the key issues we are looking at? If you understand by definition, defecation to be essentially when people do not have access to toilet facilities, or where people defecate in fields, bushes, forests, open water bodies, open water bodies. This is where what is even more troublesome, because when people defecate in open water bodies, that water is also where the municipality take in water that they treat and they use back in society. So that is a big issue. Currently we have 70% of the population in Nigeria that do not have access to toilet or clean water, and 66% of the population here in Lagos have a challenge. Then 75% of the public buildings, parks, markets, schools have insufficient toilet facilities. And even where the facilities are available, like just like it was presented, they charge money, and most of them are not clean enough, even when you have made some payment for it. So the health challenges involved in open defecation are basically water contamination, environmental pollution. So contaminated water give rise to waterborne diseases such as diarrhea, cholera, typhoid, and fever. And then the data we have is that 70,000 children under 5 years die annually in Nigeria because of waterborne diseases, and 73% of them are due to diarrhea or disease caused due to poor sanitation. And then what also indicates that this open defecation is gender sensitive. You have more women and girls being vulnerable to the health challenges attached to it than men. So improving sanitation is key to health and well-being of the general public, particularly the women folk. Already, Lagos State have some actions they've taken. Just like the Cabinet Secretary just presented. They have rolled out a campaign of at large open defecation in Lagos State. The state also has started to do some level of citizen education. And then most importantly, they are making efforts to build, replace, remodel some public toilets. However, the effort is not yet enough. There must be a roadmap, just like the first presentation had shown. If we have 66% of the population still living in slums without access to proper toilet facilities. So the way forward we are proposing is that government should come in partnership with the private sector. If the 2025 target must be met. And the strategic partnership public toilet strategy will provide like funding, guidance on the future locations, construction, quality standards, and provision of public tool that will be accessible to everyone, healthy, clean facilities. Here we have, I showed some pictures from Artline. They made some designs, and the state will go if we have partnership with such that is geared to safety, accessibility, and that must meet standards. Put into consideration the community that is to be served, the environment, cities, the economy. I know, just like the Cabinet Secretary has mentioned, that there are some private, public pet owners, but it is grossly inefficient when you can have like a mall, a big mall that has and they have just 2 toilets, one for male, one for female. That is grossly not insufficient.
Are you done? Hello, madam.
We've lost you.
Wow.
Are you through, ma?
Yes. Oh, sorry, the internet wasn't.
Okay. Thank you very much for that exposition. We'll come back to you shortly. Distinguished participants, the next presenter that will speak to us is Dr. Olamide Okulaja. Dr. Okulaja has a progressive career path in the healthcare sector, multiple focus on healthcare, healthcare financing, hospital management, information systems, healthcare quality, and business development. He's been Director of Advocacy and Communications. He has worked with the World Bank Group engagement in Ogun State and Lagos States. And recently he worked with Kwara State Community-Based Insurance Scheme. Can you let us have Mr. Dr. Okulaja address this group? Thank you very much.
Thank you very much, Mr. Kwabi. Thank you very much, everybody else. It's a pleasure to be here. It's very humbling because I know that I'm not an expert in open defecation, but I do have some opinions, and I thank everyone for giving me the opportunity to share these in my very short discussion. So basically, Lagos State's population is one of the highest in the world. When you look at the population to space ratio, and it has only been by Mumbai and Calcutta. Again, another thing to consider is that poverty rate, according to the Lagos State Bureau of Statistics, is about 66.9%. And there's a reason why I'm saying this, because one of the things that has really come out is that statistics have shown that around the world, there's a relationship between the highest percentage of those that do not use toilets or human waste facilities and low education and poverty. So therefore, investing in the health of its people should no longer be viewed as provision of services. A lot of times when there's some level of investment from both the private or the public sector, it seems more like you know, something that they're doing in an altruistic way. However, one of the things we should begin to consider is that it's a form of risk mitigation strategy that will affect all of us if we do not take it seriously. So definitely an unhealthy population becomes a burden rather than an asset, and an unhealthy population can definitely not be productive. And the World Bank statistics have suggested that regions with high rates of open defecation experience a tremendous problem in terms of sanitation and definitely proper waste management. And basically what we're trying to do here today is to find a linkage between health and environment, and looking at how we can have some level of synergistic approach to that. So I've heard a lot on this presentation and also from other people that Nigeria is second in open defecation, but actually from some statistics that have also come about, it says that Nigeria is actually number one. And this is quite sad, because when you look at the absolute numbers of a country like India that we overtook, India has a population of over 1 billion and Nigeria is just about 200 million, and yet we are the number one. Again, Nigeria is not just number one in open defecation. It is little or no wonder that we're number one in a lot of things, in maternal mortality burden, in neonatal mortality burden, in NCDs, you know, and several other things. And you know, it might not be too far-fetched if we begin to link the effects of open defecation to a lot of our health indices, because we need to begin to stop looking at these issues in isolation, but in a synergistic manner, if I would like to say, in a more holistic manner, and why these issues come to bear. So one of the things that the Lagos State government, and I'm aware of this because I've had the opportunity, and I still have the opportunity to work very closely with the Lagos State government, is if you look at the implementing the themes development agenda of the current government, one of the things that the Lagos State government did was to bunch together health and environment, because there's a huge correlation between health and environment. And in line with the pillars of the themes agenda of the current administration, One Health is a global is a global approach that recognizes that health of people is closely connected to the health of animals and our shared environment. One Health is a collaborative, multi-sectoral and transdisciplinary approach that seeks to achieve optimal health outcomes, recognizing the interconnection between people, animals, plants, and their shared environment. So basically, one of the things that is very, very important and that we need to be aware of is that there's a huge connection to the things that affect us as humans and also the things that affects our environment. So we have talked a lot about the effect of open defecation on the health of humans, but we also need to consider the effect that is having around the ecosystem which will exist. So the elements of a One Health agenda is not actually very new. It's not new to Lagos. It's actually something that has been looked at across the world. And basically it is looking at how it recognizes that the health of the people is closely connected to the health of animals and our shared environment. And because many factors have changed, you know, it's something that we really need to really consider when we talk about the effects of issues like open defecation, right? And basically, you look at the disruption in environmental conditions and the habits and the new opportunities for disease to pass to animals and from animals to humans. And you know, the movement of people, animal and animal products has increased from international travel and trade. As a result, disease can spread quickly across borders and across the globe. So you look at management of waste. One of the things that I felt that we need to really consider is slum health, because the areas that you find a lot of open defecation will probably be mostly in our slums. And you know, the current practices around the management of waste by the public-private facilities in Lagos is actually a bit suboptimal to the point of endangering the future of the state's ecosystem. And when I talk about the ecosystem, I'm talking about humans, animals, and the environment itself. And slum poverty and poor health form an unfortunate triad that ravages most riverine and coastal communities all around the world. And the slum health is a key discussion and action point if we are keen on catching up with the domestic population expansion in Lagos. If neglected, they would worsen. And the reason why I'm talking about slum health is because I'm trying to avoid the conversation around open defecation alone, but to see how open defecation can become part of a wider conversation. And so we have an opportunity to actually leverage on other financing opportunities that can be used to end open defecation. So you look at a situation like you know, in Lagos, where the slum areas are poorly planned, you know, unplanned urbanization patterns represent a major public health challenge. And the slums in Lagos have increased from 68 to 600 in 3 years, representing a significant proportion of the population. This constitutes a major biosecurity threat from airborne and waterborne communicable diseases, right? So one of the things that the Lagos State government is trying to do now in their approach is, one, to populate slums with health posts, to apply a One Health strategy to slums in the state, and to ultimately craft and deploy an urban-rural migration strategy. You know, because the more we have slums, the more we have widespread poverty, the more you have issues with open defecation. And it's important that we begin to link these issues, because as governments are trying to tackle some of these issues, we can then bring up the issues of open defecation and see how we can leverage and scale up on those interventions that have come. But again, I felt it was important to look at the reasons for open defecation. We've talked about open defecation a lot, and we've talked about the effect of open defecation, but why do people defecate openly, right? I think it's something that we really need to consider. And I came across several studies that show that it's actually a voluntary, it can either be voluntary choice or by compulsion. You know, I mean, just to crack a little joke, though, a couple of years ago, I read that one of the richest men in the world, Richard Branson, on his island, has a toilet that directly faces the waterfall without any walls. You know, so he gets up in the morning, gets into his toilet, and he sits on it. And one of the reasons why he said he did that was because it enabled him to think, you know, to think and come up with ideas. And that is some form of open defecation, right? So the people that practice open defecation range very highly, you know, between the lowest the poorest in society and the richest in society. But there are also other reasons why people practice open defecation, which are the social-cultural and traditional reasons. So for example, there's a situation where it is forbidden for a man to share the same toilet with his daughter-in-law. So basically, if there's only one toilet in the house, then somebody has to use it and somebody has to use somewhere else if he needs to do what he needs to do. There are other situations where people have said that they've done this all their lives since they were kids. They go with their friends, they go and defecate together, and that is the point, that they share ideas and they share stories of how they're going to plan their day. And these are deep-seated cultural issues. So even if you were to make available toilets, right, you'll be shocked that the availability of the toilets will not necessarily compel them to actually use this facility. So it's something that we really need to consider. How do we begin to tackle the social cultural issues that have to do with open defecation? Of course, economical issues such as poverty, we've talked about that a lot. Poverty is a huge factor in open defecation, and technological. When we say technological, again, it's not just IT, it's the availability of technology, which is actually old technology, for people to use a toilet. So for example, some cases people have said they end up preferring open air defecation due to the freedom it gives them, as opposed to using a small dark structure, or the displeasure in using toilets that are filthy or not clean. So are we considering situations where we have toilets that can actually also cater to some of these issues? Because one of the things I've learned is that if you do not and service the requirements of your customer, then you may fail in your intervention. So if you end up building traditional toilets that still have the walls, you may actually have people that don't want to use it because they want to do it in the air. So how can we look at solving the situation of sanitation, but at the same time addressing some of the concerns of the people that you're actually trying to stop these things from happening? And so one of the things I also want to consider are the catastrophic effects of open defecation on human health. So for example, in the riverine areas, which Lagos State is actually very waterlogged, a lot of us know this. And of course, if we're having slum areas going from 68 to 600, then you know that there are more people that are performing open defecation around the waters. And of course, this goes into the water, and we have more waterborne diseases. I mean, one of the things that we don't definitely want to have are issues with pandemics like cholera and other things that promote diarrhea and other things that can actually really affect society. But again, the accumulation of these feces also brings about different vectors, and it goes to the breeding of these vectors that can now transmit other diseases, and of course, compounding the problem of disease exposure to humans and also to our sea life and to other animals in society. Of course, severe diarrhea, which is caused by waterborne diseases, has resulted in a lot of our children being malnourished and a lot of child stunting. And of course, I really wondered how open defecation resulted in gender-based violence. And from the studies I saw, it was basically because as the women went out in the mornings to perform open defecation, they were more prone to crimes like rape, like being attacked and being stabbed. So actually, as oxymoronic as it sounds, open defecation is actually linked to gender-based violence, which is something that is something that is really, really profound for me personally. But of course, if you look at the environment, also you have contamination via microbes, that is actually contaminating the earth itself. One of the things that a lot of people fail to realize is that the earth itself is a living organ, and as we continue to expose it to different microbes and different issues, it also contaminates it. And we cannot understate the effects of visual and olfactory pollution that this has. So basically, I brought up this slide to show the effect of outbreaks. We are currently going through an outbreak. It's the COVID-19 pandemic. Very, very luckily that I'm involved in the COVID-19 pandemic response in Lagos. But one of the things that has been, a lot of people still don't understand how this pandemic came to pass. There are a lot of theories. that it was manufactured. There are theories that it was passed from animals to humans. But, you know, the idea again is that one of the ways that pandemics occur is actually through feces, you know, because these feces are passed and then somebody eats it either from an animal to a human or from human to animal. And you can see that, you know, if you look through all of these pandemics, one of the major transmission aids is actually through feces. So it's important that we really look at the different ways that we can insert the interventions we want to put for open defecation for us to be successful. So what are the effective solutions that I think that can, you know, to open defecation? One, definitely we need to provide toilets. But again, providing toilets, do we need to be innovative in providing the toilets? Do we need to be do we need to listen more to what actually would enable people use these toilets, you know, and do we need to come up with new designs for toilets so that we can actually tackle these issues of open defecation? Of course, there has to be corrective civil education in trying to ensure that people actually do understand the need for them to stop defecating in a non-sanitary manner, or to use situations that would prevent this. Also to address the traditional issues that come with open defecation, and of course to incentivize public hygiene participation. One of the things that I've realized in my very short career as a health financing specialist is that incentives do work, and the incentives don't necessarily have to be cash incentives, but how can we begin to incentivize public hygiene, you know, for participation, so that you now create a cycle that when the person gets used to using that intervention, then they no longer need to be incentivized to use it, and they then see the benefits of it themselves. And of course, I love initiatives like this, because what it does is that it sets a sanitation target, you know, that needs to be achieved. If an objective is not SMART, then you cannot achieve it. And when we say SMART, we mean specific, measurable, achievable, realistic, and time-bound. And that is why I think that an innovation like this is really very, very efficient and will work. So thank you very much. And I hope that I have been able to impact some form of knowledge, and also to be part of the conversation to this very erudite group. Thank you.
Thank you very much, Dr. Okulaja, for the medical angle that you have introduced. We will come back to you in a while. Next among the presenters this morning is Mr. Bilal M. Said from Pakistan. He also is eminently qualified to talk to us on the program we're addressing today. Mr. Said is an accomplished and seasoned professional leader with international experience in Europe, the European Union, Middle East, Southeast Asia, and Australia. He recently managed a public sector waste management company of the second largest city in Pakistan. He was the former head of environmental portfolio at the World Bank in Pakistan. Can we please receive Mr. Said to the rostrum to address us?
Thank you very much. Can I request that my slide be shared? Can you give me access? I'd like to share my slide.
Mr. Doherty would make sure you can share your slides in a few minutes.
Yeah, that's if I can find it where it's gone. If you don't mind, I'm sorry for that. I had it there, and let me just check. Where has it gone?
You can share your screen now. You can share it.
Yeah. Let me just see where it's gone. Sure. Yeah, are you able to see my screen? Can you see my screen?
Yes, we can see your screen now, Bilal.
Okay, thank you. Thank you very much. There's one connection. I was not the head of the World Bank. I was the environment specialist for the World Bank, based in Islamabad, and I do some consulting for them. So what I will be talking today is, it is the open defecation free Pakistan and the Punjab. I am basically going to give you some basic studies and what UNICEF and the government of Punjab, that is the largest province, which comprises about 70% of the entire population. The population of Pakistan is about 200 million. And the province of Punjab is the most fertile and has about 65% people live in the rural area and are into agriculture. So, and there's a lot of migration from the rural to the urban setup, and there's a lot of transient population that comes in out every day, especially in the city of Lahore, where I was the MD for the largest waste management company. And we collected waste about 7,500 tons per day. And of the transient, or about 15 million people that reside in Lahore. And as you know, it is Pakistan is considered to be the sixth. Let me just get this onto the. As we know in the SDGs, that's the Sustainable Development Goals, clean water and sanitation falls in the SDG number 6. And we've all got our targets. And similarly in Pakistan, there are 2 sets of targets for the year 2023 and 2025 that we will be looking at having sanitation as an open defecation-free environment, then also looking at the hygiene promotion, because that also ties in to, if you don't have good hygiene for the population, it has ill effects, which my colleagues from the panels have talked about. And in addition to that, the liquid waste management and solid waste management also contribute into the overall cleanliness hygiene of society that is which gets exposed and it affects the various diseases that human beings can attain. The clean water is, again, there is the 2030 targets that in Pakistan, section 6.1, indicating that there should be clean drinking water for all. And there's quite a bit of emphasis being undertaken to provide clean water, because there's quite a bit of groundwater contamination because of industrial activity, and also the aquifer is being polluted because of open defecation. About 40% of the population still goes, and we are probably ranked 6th in the world where open defecation still takes place. And again, another target that has been set as part of the SDG is to achieve adequate and equitable sanitation and hygiene for all, and to try to end the defecation, and especially paying attention to women and girls in our vulnerable villages. And again, there's been for the last couple of years, a lot of emphasis has been undertaken with the help of donor agencies, where emphasis has been on putting into place toilets in the rural setting also. 13% of the population, these are statistics, still do not have, basically are still going out into the open, and there's basic health facilities are not available. And as we all know, as indicated, that open defecation results into diseases such as diarrhea, dysentery, and also it has stunting of growth of children. And the program which has been put into place with the help of UNICEF and other partners is the Pakistan approach to total sanitation. It's known as the PATS program. The PATS program is basically, it's a 3-year program, and it's going to be addressing, going to be constructing 200,000 toilets, basic toilets for about 1.3 million population in around, and it will, there was a complete mapping done of the high-risk, most vulnerable villages across the province. The province in the blue, dark blue, as you see, is the province of the Punjab, which borders in with India. This is the most fertile and has got a lot of agriculture. So that's about 60–70% of the population lives in the rural setting. The program itself it's a 2–3-pronged approach. It's all starts from education. It's education through village groups, through stakeholders, through the religious scholars, the mosques, because again, in the village context, the mosque plays a very pivotal role. It is to develop the concept of community-based organizations, voluntary individuals, and they have tried to mobilize people, have given education, trainings through schools, because again, if we try and address and put in place these systems of improving this sanitation at the school level, people get into a habit. And we have some examples which I'll show that where it has made a difference to people's livelihoods. It has basically has effect because men compared to women are at more risk going out into the open, and it is always considered a security risk, and they do not feel comfortable going out into the open. And by putting in these programs, they have made it less viable or less critical for the women folk. The PETS program is basically, it is a way to, there are various components to it. There is the soft component and there is the hard component. Soft component is about training, hygiene promotion, what to do, cleaning of hand, doing proper solid waste management. And it is to basically provide facilities, sanitation facilities at the house level or in the villages, so that people can carry out, can reduce the open defecation and access to clean water, so that and properly lining the effluent that is going out through the drainage, proper drainage systems, because normally in villages you have little ponds that are outside the village where all the dirt water is collected and it becomes a big swamp, and that becomes a breeding ground for various vectors. Again, the components of the PETS program is solid waste management, liquid waste, hygiene promotion, try to put in the open defecation into place. And it's about how to do it is through social behavior changes by communication campaigns through the schools and the mosques. So this is what the program is all about. the government of the Punjab has basically got in community activists, and through these activists, they have the wash school clubs, and they have wash committees that are set up at the village level. And again, it is a two-pronged thing. It's a continuous ongoing process which has achieved results. It's about basic hand cleaning, hygiene cleaning, so that, and then also providing the hardware. Hardware is the pipelines, the sanitation requirements, providing piped washrooms, setting those up. And all these washrooms at the vulnerable villages through the grants, and some people that they use their own grant money by collaborative work in villages have set up their washrooms, and again try to have a ODF-free village and community. And then at the end of the day, rewards are given. Again, when you have rewards put in place, people feel elevated, and the process of continuous improvement continues through a regular interface with other people. Again, what has been used, various kind of pamphlets, communication processes through village community centers, through village talks, and also by handing out leaflets and flip charts and discussing at the school levels. This program has been put into place. Again, the program is that in the villages, there are, for separate boys and girls, washrooms being built up, which has made it easier for children, girls especially, to be secure and to go out. And if you see this is a basic water place, water collection, water, and this is what they've done is now put out here. It used to go into a sump, but now they've put in the drainage. It's kind of a three-pronged sump through which only the clean water goes out, not the feces goes out. These are older in villages. These are old, open kind of for places to relieve oneself. These have been made into proper mud, constructed into washrooms like this, so that there is privacy and people can go out even in the daytime. And the material distribution, it is not too much. It is like these are the squatting flush system, and it basically is collected through these pipes. Again, a lot of plastic pipes are being used, recyclable plastics pipes, because that has become a big industry in the people that can't afford it, the government grant is there to help out, at least put in, set up the system. So this is something that has been under care, the toilets being constructed, washroom at the back, and the excess water going into a pit, and gradually it drains out. And after a certain while, the sludge is taken out and then reused. So this is within the boundary wall of the house. You have now a proper washroom and people, the women can basically go out and relieve themselves within their own boundary area without having any effect. Again, out here, this is an example. I was the first person in the village to construct a latrine in my house. This gentleman, if you see out here, this is kind of inside his area. He is a village VO volunteer who basically has been advising and assisting villagers not only in the construction of latrine, but he has been on the wash committee and organized regular health and hygiene sessions. So like this, the government, with the help of UNICEF, has put in the PATS program, and which has become pretty successful from village to village. Similarly, it is another area where this is Jhang is a very primitive area in the province of Punjab, and it had very, women who used to go out into the bushes, and according to this extremely poor sanitation and hygiene conditions. Out of the 41 families living in the Zera's neighborhood, only 13 use latrines. So this is something, again, it was a daily challenge until this washroom facility. If you see, it is a very basic mud brick construction, but yet it is secluded, and it makes it easier for women or a girl like this at this age to go out into the outside, even if it is not within their own household or boundary community, but go out into a toilet facility. And again, this is kind of this. You see this girl out here, she feels happy that now I can go out to the bathroom any time of the day and not go out in the early hours or the late hours at night. She kind of, she's proud that it is, she's got a latrine next to her house. It's made life a lot easier for her. And especially, I guess it is more vulnerable, not for the men folk, but for the female. It becomes a safety concern because going out in the villages, there is crime because of women going out alone to relieve themselves. So this has become quite a positive thing that with this program in place that the government is pushing through. Again, the different models that have been adopted are single pit pour flush latrines or twin pit pour flush. They go into a septic tank and into a proper sewage system. That's all from my side. I guess the program is still going on and it will continue. It is catching on because people are, and it is a continuous awareness program has to be put into place. Even the poorest of poor people understand that the requirement, because it affects their health and hygiene. It improves that they don't need to go to the hospitals. Thank you very much.
Thank you very much.
That's all from my side.
Thank you very much, Mr. Bilal Said, for that wonderful presentation. In the next few minutes, we'll be having some questions and answers. Incidentally, my first question will be going to you, Mr. Said. You talked about the PATS program. The question is, how has the PATS program improved the water quality in the region that you manage?
See, the PATS program it's also about, it talks about hygiene and how to use clean drinking water. There is a parallel program that is the government has launched since about 6 years now that is providing clean water, and that is using, they've started to install tanks and providing filtration systems in villages. And it is a program in the entire province where there are filtration systems that have been put in, especially for drinking water. And by putting in a sewage drainage system, a very basic drainage system, collection, and having latrines in place, so the groundwater is not that much affected.
Thank you very much. Talking about the provision of toilet facilities, we know it is beyond the structure alone. I'm directing this question to Mr. Abioye Ogunjobi. Mr. Ogunjobi.
Yes, I'm here.
In the course of your presentation, you talked about the number of schools that do not have toilet facilities. And this is truly very amazing because where the children don't have anywhere to express themselves, of course, they will do it in the open. Can you give us an idea of what UNICEF can advise for the Lagos State government to adopt in addressing this challenge?
Yeah, thank you very much. I think for institutions, the school and health centers, we need more of intersectoral collaboration. I mean, we all know that SUBEB has the mandate to manage school, I mean, especially primary school. And we are also aware that in building the school, there's provision for including wash facilities, especially toilets. Now, the state government needs to really sit down with the different sectors involved. Like we have the education for school, and then we also have the for this. Otherwise, we may not be able to achieve results if we are expecting the Ministry of Water Resources or Environment to get that done. If we are able to pull the fund together, we can ensure that all those schools have facilities. But we also need to look at the private schools. Now, if we are inspecting private schools, do we have private schools that do not have toilets? This is very key. Supervision needs to be very strict, on this. I think intersectoral collaboration is what we need to ensure that all the institutions have toilets. Thank you.
Thank you very much. Somebody quipped at a time and wanted to know how improved sanitation and hygiene practices can help child survival. Dr. Okulaja, in the course of your presentation, you talked about the risk to the ecosystem and the effects of open defecation on the ecosystem. Talking about the way animal health can affect human beings when we consume animals that are sick. Can you please just give us an idea of what the state government, the conditions they can bring in to ensure that the ecosystem is protected? Dr. Okulaja.
Thank you very much, sir. I think one of the things that needs to happen, like I mentioned before, is the collaboration that needs to happen with different agencies. So, for example, one of the things that the question that I was asked was how can that affect neonatal or child mortality? Nigeria has the highest neonatal mortality burden and also the child mortality burden, and this is because we don't have a good healthcare system to be able to manage the issues that we have, especially with issues like diarrhea and other ailments that children have. But again, these issues come from the earth in what the children consume, either through food or through by drinking unclean water. And so that is the beginning of the linkages as to how things like open defecation affects and harms our ecosystem. And so I think that one of the things that needs to happen, because you see a lot of government initiatives that are happening in isolation and are addressing different issues. But if we're able to come together and identify initiatives that address, protecting the ecosystem and doing all of that, then we may be able to begin to put also issues that it is important. Can you hear me?
Yes, we can.
Hello, can you hear me? Yes. So I think it's important that we begin to look at some level of intersectoral collaboration in a situation, especially where resources have become even more scarce than before, to see how we can use the same resources to address the different issues that we have. Thank you.
Thank you very much. My next question goes to Mrs. Chizoba. Given the extensive research you have conducted in this area. Should access to a toilet be a fundamental human right? What are the implications of the health and development, for health and development?
Like even it's in all the presentations, it's obvious that we need toilets in every home because toilet is key. If people defecate openly, one of the things that happens is that it is washed down into, for instance, a water system, even underground water. From some of the samples we've taken, let me use underground water for instance. Even here in Lagos, around Lagos, it will surprise you that the percentage of fecal matter that we have in water that people take to use to cook, to bathe. Most people just in Lagos, for instance, use groundwater because the pipe-borne water is not in every home. So a comfortable percentage of the population relies on groundwater. And when this fecal matter finds their way into the groundwater, they just use it and then have issues of diarrhea, of cholera, of dysentery, just like Dr. is trying to point out. That is why we have high rates of infant mortality here in our country. And it's important that not just government, but just like Bill pointed out, there should be collaboration and some level of partnership to make sure that every home, everybody has access to toilets, clean water. Once we do that, we will see that our health issues will be addressed drastically. So that's my take.
Thank you very much. My final question for this segment goes to Mr. Bilal Said. Looking at the topography and the statistics of Punjab, we look at the population that you are handling over there, and it seems to be somehow similar to what we are facing in Lagos. Can you please guide us? Because we are supposed to treat the waste that we produce. Looking at it, it's very enormous. Some of the companies that actually move this waste around, they just dump them in open water bodies. And we believe this is not sustainable. There are few places around where they dump them. In Lagos alone, we have about 5 different places, and they have messed those places up. How can we curtail this so that we can ensure that this waste that we produce are properly treated?
See, it's a big challenge. It's a big challenge. It has to come. Number one is that there has to be regulation. There has to be implementation of the regulation, because that plays a very important role. Number two, do you have a public-private partnership, or is the waste management done by the public sector or the private sector? That is another question, because waste is a science in it itself. The traditional waste management in Lahore was done by the public sector, but it is a very specialized job now. The transportation, it's a logistical issue. And unless the proper town planning has been done, where proper landfill sites, identified landfill sites have been established, and where proper dumping takes place, first collection, and again, how is the collection done? How are the various stakeholders, the people living there, have they been taught what is waste management, what is segregation? Has waste management been taught at the school level to children? Because that's where it all begins from. You just can't bring in a system, and unless all the communication processes have been, awareness processes have to be put into place. So it's not an easy solution. It is a 3-4 pronged approach. You have to have legislation, you have to have the will, you have to have the right places. Okay, even if you do start collecting, and as you say, those 5 companies are picking them up and placing them all over the place, there should be legislation, the way to dump that. And if you're going to dump it, has there been proper segregation? Has there been, at that site, is it properly landfill, which is properly engineered so that there is no leachate that is developed and goes into the ground? So all of these, it's not that easy. It is a very difficult situation, and a lot of these, it's become a lot of the mega cities, unless proper town planning has been done, it still continues to be a problem. So I can't give you one solution. It is a multi-pronged actions you need to undertake to have a good management system. And it takes a couple of years to be able to get a good, clean city in place. I don't know whether I've answered your question or not.
Thank you very much. You have approached it properly, and I believe everyone on this platform has taken something out of your exposition. Thank you. Well, distinguished ladies and gentlemen, it seems we are done with this first phase of our discussion. It is time to move to the panel discussion where we have one more person joining the discussion. Dr. Harold Grundy.
Hello, sir. Hello, sir.
The designer.
Yes.
Sorry? Yes. Please.
Sorry, before we go into that, Mr. Doherty will has a few video skits that have been forwarded to us from UNICEF, which he will share now. And while we're sharing that, we will also share a link that we're conducting a poll, and that poll we want to have people contribute to it. So listen to the skit. Thank you.
Lazo, Caboose, you reach my zone. Hey, how na dey? Caboose, I do. As I see say almost 1 week, I never see you for park. I say, make I come check you.
Thank you, my brother. Now my pikins then when they sick.
What did one?
Now vomiting and shitting. They run out row of nyash and mouth. It can't be like say 2 of them, they exchange sickness. If one just do like say he well today, tomorrow of your the other one don't take over.
What? That one no good though.
In fact, their mama sick also last week.
Huh? Ah, madam.
Good afternoon, sir.
How are they?
I'm fine. No. Well done. Oh.
Do.
The body don't cool small.
Wait. Come. What do you want to do there? Outside like this?
How much can I change the feet again?
Yeah? Wait.
Kabu not come insult my picking when they sick. When did that one come?
You be okay. Yes. Now I understand why all of them they sick on per second billing. Yes. So you go allow your pikin shit for open outside like this. When flies go come, perch on them. From there, come on, go land on top of your food.
Now, small pikin now, in shit no fit harm anybody.
In shit, no fit harm anybody. Oh yeah, they pack, make them the shit. In fact, go from compound to compound, go they pack shit. Make they fry and chop. She be na jollof rice. No, you don't see asaro now, porridge. Hey! Wait, una no get toilet?
We get, but I no go fit allow my pikin make dem fall inside pit toilet.
Now why you suppose build improved toilet? Small pikin no fit fall inside improved toilet.
Sure. I dey tell you say all my money I don spend am for hospital finish. Where I go get money build this improved toilet when you dey talk?
Lazarus, you go decide. You go decide whether you go allow hospital people to continue to chop your money forever, or you go close your eyes, build improved toilet, and comot yourself from hospital matter. If not, all this yama disease go turn this una house to their headquarters. Oh yeah, just see now. See as flies gather plate wey una carry the chop. Where you think say those flies come from?
Sure. Babu. So now shit now put me for this high jump. Ordinary shit.
Thank you so much for that. We will now share the second video, also by UNICEF. Mr. Dorothy, over to you. Thank you. Mr. Dorothy, you're not sharing your screen. Okay.
So sorry. Just a second. I think I'm getting the wrong game. I'm playing the wrong one.
See your life. See your life.
Now what for you, Kabu Kabu? Ah, what can play with this now?
Ah. Now what for me, Abi? No, Sule. Now what for who? Why you go do this kind of thing? They shit for open place.
This place is not open place now. Here na bush.
Oh, bush. You don't know, say fly go come now, land on top of this shit. From here, waka, go land on top of person food. Rain fit even come, wash am, enter person compound. Or even wash am, enter the water where everybody from the fetch drink.
Anyama.
No be anyama. Sule, na serious sickness be that. Yes! Cholera plus diarrhea plus plenty other sickness sef.
Well, thank God, my house far from here.
Oh, now wetin you think? See, as you squat the shit for here so, now so plenty people too squat near the gutter and bush where they near your own house. Okay.
Oh, Kabu Kabu, no cost me, oh. No cost me you here, no cost me at all.
Sule, my brother. No vex, I know they cost you. But I just want to make you know this thing. If all of us don't join hands, stop these people with the shit up and down. The sickness they go round. Eh? Because nobody know the fly will perch on top of this shit now. Where you go land next.
Na true talk, oh. Wallahi, na true talk, sir.
Okay, thank you so much for that. That was a fantastic presentation. Thank you, UNICEF, for that message, that video message. So we'll hand over now to Mr. Kwobi so that we can go on to the next session of the event today, which is the panel discussion.
Thank you very much. On our panel this afternoon, this morning we'll be having 5 discussants. Of course, four of them have been introduced, and then the 5th person will be introduced at this point. Unfortunately, Dr. Harold Grundy, who should have been the 5th person, is unavoidably absent, but he will be eminently represented by Lord Christopher Ferrich, rather. Sorry if I don't pronounce the name too well. So on the panel this morning, we're having 5 people, and we're going to be discussing the WASH program as affecting COVID-19 and the waste management value chain. We believe that provision of toilet to end open defecation is not all about providing the structure. It has to be affordable, it has to be maintained in a particular way that individuals will have the attraction to use it. And then we would like to look at the key public health issue within the international development, the focus of the SDG toward the goal 6. We will, in the course of this discussion, be talking about the access to healthy and safe water, adequate sanitation, and then improved hygiene in our systems. Well, I would like to come up with the first question, maybe just to set the ball rolling. And this goes to Lord Christopherish. Given the credentials of a person that you are representing today. Of course, we have been looking towards the provision of durable cost-efficient toilets, particularly in the rural environment and in the waterfronts where people are usually not ready to pay money to access the facilities. So how do you think these toilets can be designed to make them cheap, affordable, and then fulfill the purpose they are meant to fulfill? Am I communicating? The design, making it affordable, and then fulfilling the role.
Thank you. I think it would be best to give a short introduction on what we are doing. So I'm representing EOS Next. We're working on urine diverting toilets. We have been working in the field of sanitation for the last 10 years in a framework with the Swiss EAVAC and with a grant from the Bill and Melinda Gates Foundation. So we have a quite good understanding of basic sanitary problems around the world. They do not differ that much. Still, it comes as a surprise that there's still such a high percentage of open defecation in Lagos. So we are very honored to give a few of our ideas to hopefully help solve this problem. So as what has been stated before already is that of course a toilet itself needs to be designed appealing in order to have users that are happy to use it on one hand, and if you're looking at the business background, then of course someone needs to run these toilets, buy these toilets, and make money out of them. So what we think is very important, of course, is to design toilets that are actually fitting to the needs of communities. So, for instance, it would not make sense to implement a pedestal into a washer-squatter culture. We design toilets that fit to all different applications. So we are able to provide low flush, no flush, poor flush, various materials. Durability is a big issue. So you want to have something that can be eventually produced locally, which could always be something that would come out of a rotomolding factory. Or we had some quite successful first pilot studies with concrete squat pans that can be produced on site by people who were provided with a training. Ceramic is always an option, as this is something that, as well as sanitary ceramic companies are located around the world. So for the design of the toilet itself, there are lots of possibilities. The thing that is more important in our is in our view the way bigger topic is how you deal with all the different streams coming out of these toilets. So if there are no good back-end solutions and treatment processes behind these toilets, then these implementations are always at risk. I hope this gives you a first answer to your question.
Thank you, Lottie. Thank you for the contribution. So, Mr. Okwabi, over to you. I think Mr. Okwabi is not is muted. Maybe we could go on with the discussion with Bilal. Just like Lottie has mentioned, if we do not take care of the back end of these solutions that we are proposing, the installations that we're doing will be at risk. How can we move to a semi level of treatment or to a permanent level of treatment for these facilities?
Sorry, Adilu, can you maybe articulate or re-indicate what the question is?
Okay, Lottie just mentioned that the installations that they produce or that we're trying to suggest here, we're suggesting that we should have more toilets. Lottie has mentioned that they are involved with poor flush toilets and also squat toilets. Now, what we're saying is that if we provide these toilets and we do not have at the back end to treat the waste that is produced by these toilets, those installations and those funds that we have used to provide the toilet facilities, they would be at risk or they will go to waste. How can we reasonably address this issue within the context of Lagos or with your reference to Punjab? Thank you.
See, how I look at it is that in the rural setup, normally there is not that much of an issue of availability of land and areas around. Yes, in an urban setup, you need to put into the main sewerage of that. But in a rural setup, you can have the old system of soaking pits and only the liquid goes out. If you have that three-pronged layer system that outside the flush, it goes into a pit, 1, 2, 3, which have got layers in it, and the liquid only flows out and the solid gets settled down. And then every 5, 6 months, you desludge it and make it out as a manure, or use it as a kind of a, when it gets aerated, it becomes a, you can be used as a compost outside, and only the liquid, which is, kind of does evaporates and all, it becomes easier to, it is not openly, the effluent is not put out into open ponds, but through this filtration system, you can reduce it. So it's not that much of an issue in the rural setup, but yes, in the urban setup, you need to put it into the proper sewage system. That's from my side.
Thank you so much, Bilal. So over to you, Mr. Okwobi.
Thank you very much, Architect Okulaja. The next question goes to Mr. Bilye. Given your extensive work in WASH as a specialist, now, how do we maintain a balance of our use of water for consumption, sustenance, and agriculture, and our need for hygiene and waste management?
Mr. Bia is disconnected. I think you can move to someone else.
Okay. Dr. Okulaja. Dr. Okulaja, as an advocacy and communications expert, how will you assist or what will you advise that the state government should do in ensuring that when these toilets are provided, they will not lie waste they will be actually used. Now, I'm taking from your presentation this morning that some people, it's not about giving them toilet, but they want it in a fashion that they would love to use, like those who love defecating in the open. When you put them in a closed environment, they see it as you're trying to change their lifestyle. So as an advocacy expert, how do you think we can convince them so that they don't, endanger other people, so that they will use the facilities when provided? Dr. Kulaja.
I don't know whether Dr. Kulaja is there, but can we go to Mr. Bilal again? A question came in for you.
Okay.
How can biogas generation
come again?
Okay, for Mr. Bilal, how can biogas generation
be incorporated?
The biogas generation
in any of these settings?
I've seen the question. Let me come back to it. Biogas generation, as you know, in China has become very successful, even in India, and especially where there is a lot of cattle. In certain parts of rural Punjab, biogas is being used, but it is not. It is being used between villages and villages only, and but it cannot be, because we were doing some trials in the city of Lahore, because there's a large cattle area, which is where the milk is drawn from. And over there, the cow dung is there, and which becomes a big problem for the waste management cleanliness part. But the thing is that we were looking at the gas that is produced from the cow dung go as a biogas, is put back into the natural gas system, but that hasn't really taken off. But yes, biogas, if you have small units put up, and in especially villages or some small localities, it can do away with the waste, especially cow dung if it has got a lot of cattle area, and that gas can be used for heating, and it is quite viable. And I think it's a good idea to go for that.
Thank you very much.
Okay, thank you.
May I know if Dr. Kulaja is still on? Is on? Mr. Abioye.
If he's not on, I think there are some questions for Lottie. I forwarded them to you, Mr. Okobi. Hello, Lottie. I think Mr. Okobi is having some difficulty with his connection, but I have a question for you here. It says, can separation of waste be sufficiently scaled up to an economic system? I think this is from the back end of what you said your company does.
I think this again depends largely on the setting and of the scale of systems itself. But of course, as we currently look at streams coming out of toilet systems, there's a lot of value in the different streams. So as the toilets that we are designing are urine diverting toilets, there are a lot of nutrients in the urine that can be used as a fertilizer. And if you look at fecal streams, of course, out of fecal material, you can also produce compost. So this could be one value chain of a sanitary business. As been discussed before, biogas, of course, can also be produced out of fecal material. So there are lots of opportunities. The only question always is there enough space to do so? Is it accepted culturally? There is, yeah, I think you always need to think in business opportunities when you start planning these sanitary structures.
Okay. Okay, thank you very much. I have a follow-up question also for you. It says, how cheap are the materials and components for your products? And can they be produced by semi or unskilled labor?
So as I mentioned the concrete squat pan before, this is something that can be produced by unskilled workers, yes. The only investment that you have is buying the cement. So I'm not sure about the price range from cement in Nigeria. And the only other investment you would have is a mold that is made out of metal. This is a one-time investment which you then use for reproducing these squat pans. When it comes to ceramic toilets, we of course try to target a common rate that you find on your market. So our squat pans with integrated urine diversion should not cost more than a regular squat pan that is available on the market at the moment. The same is applicable to any other toilet. So we do not want to cause any extra or additional costs on the user interface end. I hope this answers your question.
Yeah, thank you very much. I think the question is answered. So I'll go back to Bilal. Bilal, please, what are the implications for open defecation and the possible ties for the spread of COVID-19 in your region?
See, it's a very difficult questions to answer, because if you look at the numbers that are here being recorded, reported, are not that high compared to either side of our side, that is in Iran and in India. The numbers are very, very high, though the DNA and practically the temperatures are across the same. So we are still baffled by how come our numbers are not that high. Probably there could be a religious connotation that as you know, that in Islam, well, 96% of the population in Pakistan are Muslims. And they do try to say their prayers 5 times a day. And in that, you have to go in for ablution. You have to go and wash yourself and cleanse yourself before each prayer. So that could be the only possible thing, that there is a lot of washing being done naturally. And at least 5 times. And now there's a lot of communication by the government of washing your hands again and again, because there is no other reason why the numbers are not that scoringly high. So, but yes, and people out here are unfortunately not abiding by the rules and regulations as is being done in the Western world. So, which over there's more compliance. Out here in Pakistan, compliance to regulations is very, very minimum. So, I do not have an answer, but yes, this time round, in the second round, it seems that the impact is greater. Now, the immediate sphere of circle of friends and also are getting affected, I know. So it is becoming serious now. So I do not have an answer that, yes, I can only say that, yes, probably people do wash their hands, clean themselves a lot more. That is the only thing I have.
Thank you so much. I will now go to Madam Chizoba to please share her presentation for this session because she has something prepared. And also, while we look at it, we would also collect questions for the other members of this panel discussion. So, Mrs. Chizoba, over to you. Mr. Doherty, can you please give her the right so that she can share her screen? Yes.
Okay, can you see the slides? Hello?
Yes, we can.
Yes, we can.
Okay, all right. Now we just want to look at WASH, COVID-19 and waste management value chain. Already a lot has been said about WASH. The aim is improving water access, sanitation and hygiene, and to empower the communities to enhance their access to water use and safe water and sanitation services. That is actually part of what we're doing here, to do campaign, to have people to have a change in the mindset, to improve sustainable hygiene practices, not just personal hygiene, but communal hygiene. And already in the first presentation, we've learned about a lot of statistics on population that have access and the health implications and the problem associated with waterborne diseases. I just shared this map because it is good for planners in Lagos to know exactly where they have population issues, where the problem is, and where strengths, efforts need to be put in place. The implications for COVID-19 already, we know that Lagos is an epic center, and that we also understand that the basic preventive measures is hand washing, social distancing, and particularly now to have use of toilets. If you have issues on ground before COVID-19 with increase in pandemic, we saw what Dr. Okulaja shared with us, pandemics over the years, their causes, the contribution of fecal matter to the spread of diseases, And so from my take, if we have more percentages of people in the population that have access to toilets, then these implications for COVID will go down. But now, where I want us to really look at is the sustainable sanitation practices. You can see from this slide that the different sites, different aspects of interface, on-site sanitation technology, and then fecal sludge management. It is in the management of these sludges that we can actually have value, added from sanitation practices, value added like from collection of sludge from the containment, the transportation, collection and transportation must be sustainable so that you don't collect from a point and disperse it along the way. And then treatment, it's at the point of treatment, how the technology available for treatment will determine whether we are going to have biogas, power generation.
Hello, ma. Sorry, ma.
Yes.
I don't think we are seeing the same slide that you are showing us. What you are showing us is not what we're seeing.
Oh. So what are you seeing?
We're seeing something on a newsletter. We're seeing your Yahoo mail.
Okay. Maybe we'll go back. No. Sorry for this. I don't know what's going on. Advanced. Push it on screen. I don't know, but can you from your own end? Because for some strange reason, I can't even see the file.
Okay, let me
Just
try.
one minute. Can you see the slide now? Hello?
Yes, we can see the slide now.
Okay.
Yes, we can see the slide now.
It's better now.
Yes, we have the slide now.
It's okay.
Thank you.
Okay. Yeah, so I was saying that we have a lot of input already on WASH, the aim of improving water access, sanitation, and hygiene is to empower the communities to enhance their access to and use of safe water and sanitation practices. And then it's good that government, as in Lagos State, like some states in Nigeria have actually strong action to do campaign to rehabilitate toilets and then improve hygiene practices. Although we say there's a lot more to do, and they have a roadmap, and we are hoping that that roadmap, if it's strictly followed, that this 70% of the population that does not have access to toilets will by 2025 have access to toilets. And that issues of health challenges, especially to children under 5, that these statistics will have 1 in 10 will be 0 in 10 by 2025 going forward. So like the map we showed is for the planners to know where we have high population and high challenges, where it is concentrated. That is what that map is trying to show us. Summary, because already taken some time, with the implications of for COVID-19 is that if we have more toilets made available to homes, to people's businesses, surprisingly you have businesses do not have toilets. If we have toilets made available to businesses and homes, then we will have the implications for COVID-19 drastically go down, because we have in 5 persons that do not have this access as is required. So back to waste management value chain, there are actually basically 3 components: on-site sanitation technology. Dr. Bila has shown us one technology that they are using in Pakistan. So the technology that you use will determine what the value you're going to get from sustainable sanitation management will be. Now, the on-site sanitation technology from what we have here in this slide is first the user interface. From the user interface to the containment. If you have a pit latrine, what it means is that the sludge, it might have some challenges. What most people have, once they have a pit latrine, when it is filled, they cover it and then they dig another pit. But if you have a containment where the sludge can be taken, collected, and transported to a treatment point, then you have containment, a system of emptying the sludge at an interval, and then a means of transportation that does not disperse the sludge along the route, but to a point where it is treated. Now, it is at the treatment point that will determine what you are going to get. You know, whether you're going to treat to get a fertilizer, manure, or you're treating to get a biogas for power generation. You know, when you treat and get fertilizer, then you're going to use maybe in the farm for local farm, personal farm, and all that. The other things we can get also, just like he pointed out, is like you can get biogas, and we're hoping that we will not just have toilets, but be able to have value added to the toilets. You know, as we're making a design, I think our client has shown some designs that when it is incorporated, we add value, not just the traditional containment, and then at a particular time, they empty the sludge and then dispose. Some disposal methods are also not sustainable. So we're looking at a situation where we have containment and a disposal that will be of further benefit, not just wasting the waste, but converting the waste to value. So that is what I have here. And then the value chain can work well when there's a public-private partnership. The gaps that we have now in place will be closed when there's a public-private partnership, just like we've shown in Lagos. There must be an agreement between the public sector, that is like Lagos State government, and the private sector entities such as Alkaline Design. And then once we have such in place, then through such a partnership, the skills that the private sector has will be put in place, and there will be a management strategy. And then we're going to have a happier, healthier community, you know, and each party will share both the risks and the benefits that's going to accrue from such partnership. And that's what we are hoping that we'll find in not just in Lagos, but in all the states in Nigeria, so that we'll move from these statistics of being the first country with ODF highest values. And then I'll say something like Bangladesh, within a couple of years, move from 34% to 1%, you know, of people that are exposed, that are engaged in open defecation. So what we are hoping for is that it's not just to have everybody have access to toilet, but that there should be profit. If homes can be able to have designs where they can generate biogas and use it at home, even if it's for lightning, it's going to be a plus, an added value. So that is my take at this point. Thank you.
Thank you so much for that presentation. It's very, very educative. And thank you for taking the time to provide the slide. As we move on very quickly to our next sessions, because we're quickly running out of time, I would like to say that we'll be showing you also a short movie just to show just to show everyone about the challenges that we normally have when we're trying to change the cultural norms and perceptions in terms of trying to move to a sanitary way of relieving ourselves, I mean, within the country. While we're watching that movie or that video, we would like you to also participate in a poll that we are conducting. I'll be sharing that in the chat. You just go to the Google Forms and you fill it so that we can get at least some feedback from you. So I would hand over to Mr. Doherty so that he can now share the video. We put all the courtesies for the production of videos are on screen. So I think we are on. So, Mr. Doherty?
No, we've got some technical issues. We won't be able to show the video right now.
Okay, you won't be able to show the video?
Yes.
Okay. For that reason, let me share the video, and so that we can all see it and have that. So in a few minutes, I'll be able to share that with you. But in the meantime, can we please take the time out to look at the form that we've sent, and so that we can fill it and we'll get the feedback and maybe discuss the feedback before we close the session. If you have any problems with accessing the form, please let me know so I can help attend to that. The link is shown in the chat. Please note that this is in a native language, but it has subtitles. Can you hear? Can you hear it?
No, we can't hear.
Okay. I don't know why we're having these gremlins right now, but just give me a second.
I think you need to look at the audio.
Yes, I'm just trying to find out what that is.
Mba wudu Isaka, kibiru Gambia na.
Gambia.
Alafi bien wona. Kaya achalla.
Wonya mbrigla yuwa ngona.
Yuwa on tag bahala bo sawa be da yure.
Yi twente bahma.
Mbama. Oj, ma wo bahar man yiran la. Nyambo wom no to la nyarb dina bien changende bahar tum man sigande la muane.
Bozo.
Aba wom nerbo fiala. Oy, de mal barna pam, kar barna ma be fiala.
Barna kaman wula.
Kaman dam, aba jor yu amani. Kay chan ka ben shashi hafa. Ami on yishalna. Ka dot ma kan yan kalka wum. Tirkanyar biyarin niya. Ka ko tirkanyara. Aya ki tirkanyara. Kasmin bo no kora la be kora bo. Awumda. dot matin yaya ni an ka ga tin yeti tibu tuna ta damdar yiran la biyan bartama mu ana yiran la
wa toran nan ka biya ne zo ba din ye yun in yin gunya ma kaman yirta damin da
wai za biya ya rasulullahi ka nan da ba
karan yin din da gunya damin ma gbari ba ba fiya
da ko ba fiya za ba bi da ba fiya da dot ma za sa fara yan don don ne
wa wato ai ne zuwa na to gu bin da ma kazan tuna no to gu mana ka zan nan ban jiro ka
a ce ka tun yel mangale dot ma ne yirna shelan bara azala bida ka lafiye karnya dine nda tukcho ko ngonya vele
gonda kuwo
cirkanyar nda kuwo ora ku nyela bida gbar la ha ka tin saram ntichi
karinya la ngunya inyin nda palma la do shadin da kuwo bima madinin mayo ma
woi kanya mu zuwar ka karka jiya
karala la jottu ma za yirla bangir shangatin damdar yiran ma
ne dibla shan alam bang chamtu sunga ku changa shifte ne kapala atin nga yi
wa karangunya ndin yan pa ngo viyu don mun ba za ngo ma ka ta damda
hoy
kara ayem na kamande bin damdar shanguma ba virla ba gbuna be ba nyir forza na wure yishel da ba ma
wanda jinan ya ka da gwarlan ba minya to sheba yula pa ba gbuna kamiran barsham ka forsha
wa kara wurin da tuna yil kambe so kam kuma ma ko nan banjira san no wayan
a cika tun yalma la ka yalma da tuna mal banjira ayima
karan wunya da simzi kap doyla la pasar bla ko bo nyenya wayan mal banjira biye de ka boy kana sa to do ba ku to so kule ko ten lere beten lere ogbara sambana la ngba shire
abon ma yaman ka yalma amara timsin ya annonin yalango kafta buwa sa biaw
dan paya janga ma yin nima da tun ba yina ta liye ba bangsum in taba bambami ka ba banka bla dam da la banjira yiran ma
a cika to ran ta kan ti yul bolan ma ya Mr. Gana
paya
dan so kan cen nan da
paya
yu ana dam da yiran nyala ban shadan ba fiala kan dan male sa su mun babo nan yele ne kati assembly mala nima malgo mandaba nanama menengon kamza sanato nkon man ntamnu katilyenir bo bangsam nzan pala polo neka nyar neka hanyinde tinya ka so kere yuane no te damde biyo to boho manga karpadan tu kamata anyela ngun to nyina ntulio de bangsam kan yezan pa dote shenga dem biara pune me gbalbo fiefiem nyela ban shatna bondi polio neka zom pielgo silmen sinen ka te bolle trakoma kache kolara denye tirkan nyara ne kan wani ma za nyela ba shatin yara betin jirna tu yuana damdubo yiran sham ne kan kpahara yino kam za sa zone ne mabe ngun kam za sa tin yaka so chen no te damdu yuane damban nan kamata anato mpahanu be entamnu katela nirma dambu tusham karatu na to yina npanga manga mye banjira nzala amamang dahlal yinga be shadin cheka din yanguwa kace la dotungo balbo kamzasa abiagone mena jindale pune ne kan yanne en yule mba Gana kamalla balngo ntir so kamzasa bangwe ma ka ta anu dele ka din yaban shadin to sonte to so abiaw mpaya ai kawla ka ta miye da mangandala
bangira ma
ai ma mire karnya amja agba
ai ta can hakan damne
to ta chama ka ta le damde ya kan so ka damde
Okay, thank you so much for that. That was, I hope we all got the gist of the video. Can you all hear me? Everybody is muted, so I can't. Hello?
I can hear you.
Yes, we can hear you.
Thank you. Okay, thank you. I hope we got the gist of the video, and I hope it was enlightening as well. We would now, at this point, go to the presentation from EOS Next, which Lottie would present for us. Lottie, you have the option of sharing your screen, or we can do the presentation for you?
I'll try sharing my screen because I hope that the videos work that way. If that's all right.
Okay. So for everybody's information, Lottie is representing EOS Next. They are pioneers in the technology for separating human waste, which is urine and fecal matter. And the idea is that if we separate these two entities, we'll be able to have some sort of nutrient extraction and also improve the sanitation and also the value chain in the disposal for the human waste. So Lottie works out of Austria, and she'll be doing this presentation on behalf of her company. So over to you, Lottie.
Yeah, thank you for the introduction. I'm sorry. I hope you can see my full screen. I only see a cut segment. If this is a problem, I will find another solution. So as I briefly explained before, we have been working in the field of bottom of the pyramid sanitation for over 10 years. The project you see on this side is a project that we have been developing together with Swiss Airvac about 5 years ago. This project was already a squat pen user interface separating urine from feces and flush water. The back-end technologies of this very compact toilet have been developed by Swiss Airvac. I have to admit that the toilet these days is not as compact anymore, as the back-end processes have become a bit bigger. So the image you see here is still working on a container-based sanitation approach. What we are working on is urine diversion at source. We developed a passive, invisible technology that does not require any mechanics. It works like a teapot. I think some of you might be familiar with, once you're pouring a cup of tea, sometimes the water dripping out of the pot stays on the teapot and not enters the teacup as you wish. So this is an effect that we are using for separating urine. So the challenge that has been addressed in some of the speeches today is that that there's a lack of circular economy systems behind toilets. We were briefed to develop a urine diversion toilet. These toilets are often dirty and smelly and not used properly. And one thing that has also been addressed a bit is the lack of safe disposal of nutrients into water sources. So as we heard before, lots of waste is being disposed in the Lagos Lagoon. In urine especially, there are lots of nutrients that should not end up in water streams untreated. So this is a urine diverting dry toilet that you find widely spread in South Africa. And what you clearly see on this image is a misuse of these toilets. So the front part of the toilets is often used as a trash bin. And as you see from this separation edge, it does not really work for children, as both urine and feces will end up in this front part. This is a section through a conventional urine diverting toilet, where you clearly see the problem of feces landing in the front part and trash being disposed as well, while feces should go into the S trap and then into either a sewage stream or a septic tank or a peach-lit latrine. So our technology, basically, what we did is we researched on the on human factors, so on the position and the angle where the urine stream is leaving the human body. So on the left side, you would see a male user urinating. On the right side, you see a female user urinating. There was a lack of literature and scientific data on this, so we did a very intensive research ourselves. There's also a small video. So with the analysis we did on human factors, we were able to determine the exact area where human urine would reach any toilet user interface, which then helps us to design the perfect spot for the separation. So this is the teapot effect that we are using. With a high velocity of the water, the water jumps over the edge, as on the right image. And when the velocity is very low, it sticks to a certain radius. So this is the effect we're using for separating urine invisibly. So here's a very schematic section through our toilet. In this example, this is a flush toilet. The effect can, of course, be applied to all typologies. So the urine enters into a separate stream, while feces and flush water are being connected to another back-end treatment process, or to a sewage pipe. So there's also a small video of the events that are occurring in a toilet. So the flush water does not enter the urine stream in our technology. In order to improve the efficiency, we worked together with the Swiss university that helped us with flow simulations. So this here, for instance, is a flush event where you see that the flush water does not enter the urine separation part of the toilet. So we were able to field test a couple of our designs in South Africa in the last 1.5 years, proving that we have very high urine separation rates, and also, of course, evaluating user experience. So I will show you some images. This is a lab test where this is a flush pedestal, and on the left and on the right side you see two scales where the different the different streams coming out of the toilets are being measured and then compared. So this is another test with another ceramic wall-hung urine diverting toilet. This is a pure flush toilet, a pedestal, so a bucket flush application. This is a combined unit of a urine diverting toilet with urine treatment, a water recycling structure, and also the space for a feces treatment process. This is something that we field tested together with the Swiss EAVAC in South Africa last year. This is also a project funded by the Bill and Melinda Gates Foundation. So our responsibility was the overall design and the user interface that is integrated in the inside of this toilet house. Then we have currently one field test in India where we are testing a squat pan, a pure flush squat pan. This is something that also can be cistern flushed, but as this is a very bottom of the pyramid application with very uneducated users, we decided to go for a very basic application. Again, here the separation rates are very high, and the users do not really notice any difference. So one key aspect is always that this separation is invisible, and that the urine diversion does not cause any behavior change. So we are currently partnering with a few companies around the world. What we're looking for as partners in key markets that are interested in integrating our technology. We are able to integrate this urine diversion technology in every typology and in almost any material, and also to specific needs. So we're, for instance, currently working on a unit with a very, very low flash volume. This is something that we of course always first design on a computer, and then with early stage prototypes we do first evaluations in our labs, and then if possible field tests on site. So this was the first toilet that we were able to industrialize with a European company. It's a wall hung ceramic flush toilet. Again, the urine separation is below this edge, so it is invisible for the user, and the toilet looks like a conventional ceramic toilet. This is a toilet we did together with a South African company called Envirosan. It is an insert to one of the existing outer shells that is diverting urine. And as it's a toilet day to day, they have the handover of a couple of first units to a school in the Durban area. So again, a different typology. This is a flush toilet that uses only 2 liters for flushing, and it's made out of plastic. And the technology again works as well. Then this is a pure flush pedestal that you have seen in one of the previous slides. It works with a bucket. Again, very low flush volumes, around 1.5 liters. This is ready to be produced. We are currently looking for a producing partner. Then this is the squat pan that you've seen prior. This is being field tested. Here again, we're looking for possible partnerships and producers in key markets. Of course, if bucket flush is not the technology that is desired, this can also be designed for a cistern flush. We're also looking into dry toilet solutions. Yeah, again, here a few key facts. So the urine trap diversion toilet is enabling nutrient capture and recovery. Urine is being separated at source. And the urine trap technology complies the ISO 3500, which is a standard that has been developed by the Bill and Melinda Gates Foundation. Yeah, I think I managed to stick to my time slot. Thank you very much for your attention, and I'm looking forward to questions if there are any.
Thank you so much, Lottie. I think I really got excited by that. I don't know whether anybody else did. For some reason there, I looked at your instrumentation console, and I also looked at the toilet, and it looks as if the instrumentation console was a rocket ship, and the actual toilet was something that was very rudimentary. So there's a lot of technology in the basic thing that we do right now. And you know, I think it's worth it for us to go further so that we can actually understand what is actually in the cycle that we have, and we can bring out the inherent the value in the system. I don't know whether anybody has any questions for Lottie, so that you can speak to her directly if you do. So I'll just make the floor open for that at this time. Do we have any questions?
May I come in, please?
Yes.
Okay. Thank you, Architect Kulaja. I actually appreciate the presentation. Thank you, Lottie. And definitely great technology there. I was just thinking if Lottie can give a kind of range of costs, from her own side, I know it won't be the same as here, but from her own experience on this technology, maybe a kind of range of costs, for your own, environment out there. So that's one kind of has some little idea on how it can go. Maybe you have something to say on that. Thank you.
Yeah, this is a very tough question to answer because it is always depending on one hand of the technology, and as I mentioned before, lots of labor can be sourced locally. So we really try to place the products in the key markets at a standard price. So it should not be, for instance, in India, a squat pen is about $10 US. So our squat pens shall be in this range of price. Otherwise, people are not going to make this extra, or otherwise they will buy a conventional squat pen and not a urine diverting one. So, and from the production, there's this again depends on the material, but from the production is not a huge difference. So in terms of prices in Lagos, I honestly have no idea where sanitary ware is positioned on prices.
Thank you very much.
Okay, if I may come in, I would say that from what Lottie has described, and I would say this based on the fact that I have had a couple of interactions with her, what the company is actually trying to produce is to bring in technology in a very simplistic way that also does not alter the cultural norms and the way people actually go to relieve themselves. The material can be in either ceramic or plastic. When it's in plastic, it's highly polished so that the fecal waste doesn't adhere to it. And also there is very efficient separation at source. So separation at source can give you a lot of value from the urine, where you can actually get nutrients out of it. You can get nutrient extraction. And from the fecal waste, you can get a lot of phosphorus and nitrogen, which is very important for agriculture. And also, after that is extracted, you can also use the waste and add it with some other organic materials to make organic fuel, like something like a charcoal fuel that would be useful for many rural dwellers, which would definitely be cheaper than their source of fuel. So when you look at the unit for a toilet, in those materials, I can tell you fundamentally that it would ultimately be cheaper than your normal sit-on toilets that we have. A typical idea of a sit-on toilet from a manufacturer like Twyford will cost you about 65,000 Naira plus. And that is just the cost of the item. That doesn't include the cost of transporting it to your location and also installation. So by the time the items are actually made out, even in ceramic and in plastic, it's a game changer in terms of the cost to the end user, and also in terms of the technology that is used to deploy this product to the end user. And it will definitely continue to bring in or bring out the value chain for the circular economy in the waste management environment. Thank you. So are there any other comments or questions from our attendees today?
Yes. Yes, I just want to appreciate Lottie for her presentation. My name is Chisoba. Can you hear me?
I believe she can hear you. You can go ahead, madam.
Yes. I just want to appreciate her for her presentation. I just want to also make an addition that when you separate urine and use it, and then the fecal sludge, and it is used at source or transported and used also for another product, we are just reducing the quantity of nutrients that get into the water bodies. You know, like when you have more nutrients in the water bodies, you are going to have something like algal bloom, apart from water contamination. You know, there was a question about ecosystems, the impact of open defecation on ecosystem. So if you have more nutrients into the water bodies, then you are likely going to have algal bloom like water hyacinths, and then that navigates, that brings problem of navigation in the water body. I know that here in Lagos State we have problems of water hyacinth in the water bodies, and once you have high nutrients in the water bodies, you're going to have acquisition for all those aquatic organisms, like fish kill. You have more fishes that are dying in the water bodies. And so this technology, we hope with you, architects, that we're going to incorporate it in all our activities between now and 2025. We are looking at this road.
Yeah, thank you. This is a very important point that you're mentioning, that of course with urine going to water bodies, you have a lot of nutrients in the water, and this will then, as this works as a fertilizer, it will increase the plants growing in these water bodies. So of course, separating this at source and treating it separately has a big effect on this.
Okay, are there any other questions from our attendees today? Okay, anyway, just to close in on that, I think Lottie's presentation actually highlights the importance of the circular value chain that we actually need to introduce in the economy of Lagos. We have such a huge number of unemployed youth, and I strongly believe that if we engage in a very creative way, we can find ways to make sure that all these youth, even if they are graduates or unskilled youth, we can find ways for them to gain employment and to have a reasonable earning for themselves. From the point of even the products that are sold, if we have a sustainable way of presenting a neat way of even presenting the toilet, because even from all the presentations I've seen, even the rural ones, it looks like a very, very primitive and unsightly place to go. But if the toilet were very youthful colors and was clean, I think people will be more attracted to go there, and people will be more encouraged to be part of the value chain, and it will not be stigmatized. I think going to the toilet is as important as your healthcare, having a meal or sleeping. It's part of our bodily functions, and we should not look at it as something that is so distasteful. It is only because of the attitudinal way that people have looked at it that we have found it in this negative way. The narrative is very negative. But even from EOS, we have seen that even the Bill and Melinda Gates Foundation are very interested in this. And the technology alone for where they have gone to separate waste at source is very, very encouraging. So there's a lot of science and technology involved in that. And once we can find the niche for that within our own environment, we'll start to see that we'll have ubiquitous toilets in Lagos State. The environment will be clean. We will have less health problems. We will have less pollution into the water body, and we will have more aquatic diversity in our lakes and rivers. So I really want to thank you, Lottie, for taking out the time, and I appreciate your contributions to our discussion today. So I hand over at this time to Lawyer Doherty to sort of round up, and let's see how we are on our session, and quickly close the session. We've spent about 3 hours right now on the session, but I really want to appreciate everybody for their time and their commitment to stay on the call. Thank you so much. So I hand over to Lawyer Doherty.
Okay, thank you very much. Thank you, Architect Okulaja. I want to thank everyone that has been part of this program. Let me start by appreciating the convener of this program, which is Architect Okulaja himself. He's done a wonderful job in contacting different participants and speakers and championing the cause of this program. He's a very passionate person about ending open defecation in Lagos State and learning from best practices. So we appreciate that. So you can give him a thumbs up, or you can send something to him on the chat box. And also we want to say a big thank you to all our speakers, keynote speaker, Mrs. Aderunke Odeneye, PS, Ministry of the Environment, Mrs. Chizoba Chiweze, thank you so much. Dr. Lamide Okulaja, thank you so much. Mr. Bilal said, thank you so much. Thank you for sharing all those experiences with us. And Mr. Bioye Ogunjobi, we really appreciate you. As well, Lotte, we thank you also, we appreciate you. For all our participants, for your patience and being part of this program, we say a very big thank you. And we look forward to seeing the positive fruits of all these discussions and deliberation that we've had. I'm sure that this program also is recorded, so we could share the link in case you would like to check some of this recording later. We send the link across to each one of us. And if you are yet to participate in the poll and you are still interested, if you check the chat section, you will see the link there, and you could send in your, you can take part in that. So thank you very much, and we look forward to another time when we reach out to you and we hear from you.
Thank you so much, sir. I just want to ask Mr. Okwobi also to thank him for chairing the panel discussion and also for aligning with our guests when they were doing their presentation. So Mr. Okwobi, a few words before we close the session. Mr. Okwobi, are you there?
Yes, I'm trying to, okay. Thank you very much, Architect Okulaja. To all participants, I want to say a big thank you for sparing the time to be on this platform. And then to all the presenters and the discussants, we so much appreciate the information shared, the knowledge that have been passed across to us. And I'm sure that the Lagos State government and indeed Nigeria will benefit from some of the things that we have discussed. And we expect to see a better and a more fulfilled Nigerian nation where sanitation and all other things will be in good perspective. Thank you so much. We appreciate you.
Okay, thank you so much, everybody. I'd like to thank you again.
Thank you, everyone.
Yeah, I wanted to
back.
bring the PS, yes, to say a few words.
Oh, thank you very much. I'm happy that I saw the laboratory and the technology and the harvesting of the wheat and everything. I'm actually coming from the people out there, those who really open defecate, and we're able to sensitize them in various language in terms of Pidgin, Yoruba, and we got a comedian to show them how unhygienic and undignifying it is for a human being to just go out there giving reasons that there are no toilets and just doing it. Then I was able to bring out the investment part of it, that everything that comes out of us is money. And so the private toilet owners have promised to also, tag along with us. We actually had some private toilet owners whose toilets were actually mobile toilets. They'll just take them to a location and leave it for a while, let people pay. And then as we speak, some are even donating private toilets to some hotspots. So it gladdens my heart that we're celebrating this year's World Toilet Day with a bit of a difference, plowing back to environment. People have made up their mind to do something, and I know that when we have a mind to doing something better, our goal of reaching an open defecation-free country by 2025 can actually be met. We can do it. Yes, we can, if we make up our mind to do so. So we've enlisted in the army, and we're joining critically the roadmap to 2025, making sure that a lot is being done. So I'm sure we'll be ticking the ones that we've done, and we'll be, setting the standards, watching our milestones, and encouraging everyone. And then we also learned that all hands should be on deck. We need the researchers. We need to break the dichotomy between the gown and the town, so that all the researchers in the universities they'll come up with pilots, and we'll see it work according to our culture anyway, for it to be sustainable. We found out that as we speak in our compound, we have a prototype of a dry toilet, but people don't use it. They feel that it's like a taboo for their poo to just go somewhere without water flushing it away. People always want to use water. So maybe some will have to work more on sensitization, advocacy, education, to make sure people understand all these issues. But thank you very much. I've gained a lot coming back. Well done.
Yeah, thank you so much, madam. So I will give the floor to our speakers, including Lottie, to say a few lines before they go. Thank you for their time. So Bilal, you can go first.
Yeah, thank you very much, Adalu. It was, I don't know how much I brought to the table, but that is my overall viewpoint, that what is being done in the Punjab, the largest province. And I really enjoyed Lottie's presentation from Austria. I used to work for OMV, so I know quite a bit of Austria. And I'd like to be in touch for your design work for toilets to basically bring it back to Pakistan. Thank you very much, Adalu.
Thank you so much, Bilal. Lottie?
Yeah, thank you. Thank you very much for inviting us and for giving us the opportunity to present what we've been working on in the last couple of years. I really hope this was inspirational to all of you, and I'm looking forward to having further discussions. I'm sure we can support you on your way to end open defecation in Lagos.
Thank you so much. Chinwe. Madam Chinwe.
Yes.
Can you say a few words, please?
Yeah, thank you for this gathering. I thank everybody for participating at the time they had. It's a very fruitful discussion, and we hope that the ball has been rolled and we'll be able to meet up with what is happening in the whole world and take our country, even our state here, Lagos State, away from from where we are statistically to a zero open defecation. So we are here to collaborate and work to make it feasible. Thank you so very much.
Okay. Thank you so much, everyone. At this point, I would like Mr. Doherty to please put up the last slide, which will give you the email. If you have any questions about the session, if you want any slides or anything that has been mentioned at this point, please send it to that email address. Lawyer Doherty, can you please put up the last slide and share the screen so that everybody can get that email? Very, very important. And we would like you to please continue to spread the word and spread the news that open defecation is not a good practice, and encourage open defecation. We would always send you more information as we can, and we also encourage you to volunteer for this ending open defecation. And also we encourage you to please fill out the poll that we have sent out. Thank you so much. It has been a pleasure hosting you. My company is called Alkaline Beehive Design. We're a facility management, project management, and architectural firm. We're based in Lagos, Nigeria, and we are passionate about health, hygiene, and the environment. As mentioned before, I am part of a group of people around the world that are invested and connected with the environment. And that has to do with the leadership for environment and development. We have quite a few fellows who have participated in this event today. I would not mention their names, but they know who they are. But the important message is that we should note that the leadership for environment and development had played a significant part in making sure that this event has come to fruition based on the training they have given their fellows and also the encouragement they have given them to go out and do what is needed to make our world a better place. So thank you so much and hope to see you in the near future. Thank you and have a wonderful day. Bye.
Thank you.
Bye. Bye-bye.
Bye.
Bye-bye.
Bye.
Bye-bye.
Thank you. Well done.
Yeah.
Bye. Thank you so
Well
much.
done.
Wonderful presentation. I love that.
Thank you so much.
Bye. Thank you. Bye.
Bye.
Thank you.
Thank you.